Morning, everyone. My name is Dr. Noora Malik. I'm a doctor of acupuncture and Chinese medicine. I'm a diplomat of Oriental medicine. I'm board certified, nationally board certified. I've been practicing for about 8 years in acupuncture and Chinese medicine. I also have a background as an environmental health scientist. And I have a busy, alhamdulillah, busy practice in Irvine. I'm located behind ICOI. In my practice, I see lots of different patients. I see a lot of pain for fertility, things like that. But today, I'm really going to focus on how acupuncture and Chinese medicine can help with balanced and graceful aging. So I will share my screen. Should I share or do it from your
Yeah,
end?
yeah. You're more than welcome to. Do you have access?
Yeah, let's
Perfect.
see. Okay,
I did make you co-host, so
I
I
think,
believe it should
okay.
let you.
Yes, I think I got it.
Perfect.
Okay. Okay, wonderful. Can everyone see this? Okay.
Yes, we
So,
can.
okay, wonderful. So today I'm just going to share with you how natural medicine can help support you in every stage of life to have you feeling your best. And just to reiterate, yes, I'm a doctor of acupuncture and Chinese medicine. I've been practicing for over 8 years. I've seen over thousands of patients, and I've helped them improve and manage their pain, to sleep better, to have more energy, and to just age gracefully. So today's session, I'm just going to share some information about how acupuncture can support some of the most common concerns in the aging population, like joint pain, difficulty sleeping, to improve digestion and to improve memory and clarity as well. And how traditional Chinese medicine can actually encourage the flow of graceful and balanced aging, and some techniques that you can actually take home and try, like acupressure. So to start off, I'm just going to briefly summarize what acupuncture is. It's been around for over 3,500 years, and it's an evidence-based medicine backed by scientific research. And it essentially uses very ultrafine, thin needles at specific points in the body to help restore balance and promote healing. Some of the scientific facts about acupuncture is that it regulates the nervous system, the parasympathetic nervous system, and that's the part of our nervous system that is activated when we are relaxed versus when we're stressed, we're in the other part of the nervous system. So it regulates our nervous system. It reduces local pain and inflammation as well as systemically. It improves blood circulation, and it promotes overall balance and homeostasis in the body. So essentially, how it works is your body is sending healing signals through networks in the body, through nerves and blood flow. So acupuncture helps to open up those pathways. It's essentially like clearing a blocked stream. When things are blocked, nothing is really moving. But when things are open, the stream and the water is flowing, your body is in less pain, stress is calmed, and balance is restored. So, a little metaphor: when circulation is flowing, you feel well. And when your circulation is blocked, symptoms appear. So, acupuncture is very gentle and very safe. It's tailored for your comfort. So, a lot of people are very surprised by how gentle and painless it is. They barely feel the needles at all. And for the aging population, we use fewer, shallower points and more gentle techniques. So, every treatment is adjusted based on the person. And acupuncture is surprisingly drug-free. It has no side effects other than that you may feel better, you have more energy, you'll sleep better, and it can safely complement your current care. So I work with you and your current health providers to improve your outcomes for your health. So just a quick, maybe show of hands. You can put your hand up. How many have tried acupuncture before, or cupping? And what was, yeah, we'll do the Q&A to the end, but a quick show of hands. How many people have had done acupuncture? Okay, I see a few. Wonderful. Okay. So some of the common health concerns that we treat in my clinic are a lot of joint pain and arthritis, sciatica pain, numbness or tingling in the hands and feet. It's called neuropathy. Trouble sleeping or staying asleep, waking up several times a night to use the restroom, or just difficulty falling asleep in general. Some digestive discomfort, bloating, gas, just digestive issues in general, and just memory lapses or brain fog. Just feeling like you can't really remember where you just put something, that you were just holding a few minutes ago, and just low energy or feeling very tired, sleeping several hours, but not waking up feeling refreshed. So how acupuncture can help? It does reduce that pain and stiffness in your joints because it promotes blood circulation. When the needle is inserted locally, it promotes blood circulation, and blood brings oxygen and the necessary material that your tissue and your muscles need. And it regulates digestion and it eases discomfort. Again, it does improve blood flow and actually helps local nerve growth because acupuncture surprisingly works on the brainstem. And it sharpens your focus and mental clarity. It balances the nervous system and calms the mind, helps you sleep deeper and more restful. And it rebuilds your energy and your stamina and promotes vitality. So, some of the things we use in the clinic, everything is surgical grade. We use surgical grade single use acupuncture tools to practice safely and with precision. Everything is sterile, everything is single use. Our needles are only used one time and they are disposed of in a sharps disposal box. We use alcohol prep pads to sanitize the skin. We use a clean field. Everything is organized in a way where everything is just very clean, and everything is single use. We use point locators and guide tubes, and we use several tools to help with muscle stiffness and spasming and pain, including infrared light, myofascial tools, and gua sha. This is my office in Irvine. As you can see, as you step in, that's where really the healing is. It's a very calm environment for you to relax and also improve your pain to help you sleep better. This is where the consultation happens, and then you move to the treatment table for treatment. So I wanted to share some real stories from several patients that I've treated over the years. And I've had, for example, a 7-year-old patient come in with chronic knee pain that, walking was really a struggle. And after several acupuncture sessions, we targeted circulation and we reduced inflammation, she told me that she walked around the block for the first time in years and she wasn't afraid to fall. Her stiffness was reduced greatly and she didn't need her cane to walk indoors. Another patient who was 64, she had diabetes and she had that neuropathy, that numbness and tingling in her feet. We used acupuncture points to improve circulation and nerve function. And after 5 treatments, he said, my toes feel like they're waking up again. And he didn't feel that constant buzzing anymore when your feet are numb. Another patient in her early 70s complained of bloating and sluggish digestion. And after several sessions where we worked on, dietary therapy and improving her digestion, she reported feeling much more comfortable and that she can eat dinner again without feeling like she swallowed a balloon. And another patient who had trouble falling asleep, he would wake up 3 to 4 times a night after regular acupuncture and herbs. He said, I haven't slept this well since I was in my 40s. So just a few stories about patients' experiences. Next, we're going to just do a quick acupressure that you can do at home, quick techniques that you can try anywhere you are. So we'll do 3 points today. We'll do 6 points, and these first 3 are for calm, for energy, and pain relief. So the first point I'd like you to try, it's called yin tongue, and it is in between your eyebrows. I want you to get your finger, and this point is right here, between your eyebrows. And this point actually activates our prefrontal cortex. This cortex is responsible for emotional regulation and it activates that parasympathetic nervous system that's responsible for relaxation. So press it gently for about 30 to 60 seconds. If you actually really feel, you'll feel a little groove underneath this point. If your finger is, as you feel that, it's that little groove. So press it gently for about 30 to 60 seconds. Whenever you feel stressed or agitated or just overwhelmed, you can press this point safely and gently, and that activates that part of your brain. So this is called yin tang. You can use this at any time. Another point that we're going to use, it's actually below your knee, below your kneecap. If you make 4 points, put it beneath your kneecap and go 2 points on the side. This point is going to be that little groove that's 4 underneath your kneecap and 2 to the side. So it's going to be that little groove next to your big tibia bone. And it actually sometimes might be sore in people. But this point is actually the most extensively researched acupuncture point, and it modulates the autonomic nervous system, which is the umbrella nervous system in our body. It improves gut health, it reduces inflammation, improves digestion through the vagus nerve, which is the longest cranial nerve in our body, and it actually increases your white blood cell count. This has all been extensively scientifically researched through the gold standard randomized controlled trials of research. So massage this point in a circle. You can do 1 minute on each side for balance. And the third point that we can do is called Li4. It's called Hegu, and I'm sure everybody has heard or seen of this point, and it's this point right here. If you open up your hand, it's going to be this point right here. And a lot of people, this point is actually sore. You can press it gently. And this point is actually used, it has a wide array of functions. But the reason it does is because it activates the PAG, the pearl-alkyl gray region in the brain. And this is the region in the brain that actually is responsible for pain, and it releases natural opioids and activates your serotonin pathways, that feel-good hormone in the body. So you can press this gently for about 30 to 60 seconds, and also avoid this in pregnancy because this essentially it helps the body sort of release. It's very calming. So in pregnancy, this is a point that we do not do.
नहीं पूरा है. We missed 20 minutes.
Okay, let's go to the next slide. So this is going to be acupressure for sleep and nervous system support. The other 2 points that we're going to do, this is called spleen 6. And I want you to, on the inside of your leg, on your ankle bone, okay, make another 4. And on the right on top of your ankle bone, right where your index finger ends, let's say your ankle bone is right here, it's on the inside, where this index finger ends, there's going to be a point. It's called spleen 6. And in a lot of people, this point is also sore. But this point actually communicates with your pelvic organs and your digestive tract. And it reduces cortisol, which is a stress hormone, and it aids in sleep and actually balances hormones for fertility. It's used in menopause and during women's menstruation. So you can massage this point gently for about 30 to 60 seconds. A really important point that can be used for sleep issues is actually called on-mi-on, which translates to peaceful sleep. And the way to find this is actually in this little groove in the back of your head. If you just get your finger and it falls into this little groove, and a lot of people, this point is also very sore. But this activates natural melatonin production in your own body without taking anything. And it reduces nighttime cortisol levels, which could be interrupting your sleep. So press this for 1 minute before bed on both sides, and it'll help calm your body and also produce that melatonin that's important for sleep. So I've shared a lot of information, so I'd just like to stop here and to see if anybody has any questions, and to also ask you, what part of your health are you most motivated to support? Are you surprised by any of the information that I shared, that acupuncture can help with some of these things? I'd love to answer some questions. I'll give it away to Zoya.
Thank you so much, Noora. Again, if anybody has any questions, feel free to ask in the chat or ask out loud. Yes, go ahead, Tanipay.
Most of the time, people are worried about the expense. Is that covered by Medicare?
Yeah, so in my clinic, I do not accept Medicare. I don't bill Medicare directly, but if you have a supplemental plan like PPO insurance, I can provide something called a super bill, which has all of my license information, my NPI, and you can submit that to your insurance for reimbursement. Yeah,
Okay, thank you.
you're welcome.
Thank you, Nisha. She'd love to comment for you in the chat.
Okay,
How
let
about
me.
Kaiser? Do you accept Kaiser?
So I do not bill insurance directly. So if
Okay.
your plan has out-of-network benefits, PPO, you
Okay.
can contact your insurance. I'll help you. I'll give you some questions that you can ask them to see if, you have out-of-network benefits, and I'll provide you with a receipt, and then you can contact them with the receipt, and they can reimburse you directly.
Okay. Thank
The
You're
only
welcome.
reason why Medicare doesn't cover that? Such a important medical.
Medicare
No.
actually does cover acupuncture, but the specific provider needs to bill insurance, the Medicare directly. I don't participate in that program only because it's a very big headache to be a part of that program, and their reimbursement is just not. It's
So,
they give us a lot of issues.
so we can ask our own physician then to see if they can handle.
Yes, you would contact the insurance directly. Yeah, your PPO. Okay.
Nisha,
Let me see, is there a way to access the chat?
yes. So if you go ahead and go towards the bottom, you'll see like a chat button.
Okay, I access.
Click on that,
Okay.
and then you'll kind of
The
just
last thing I see is lots of useful information provided at 11:21.
yes.
Is there any question? Okay, wonderful. Well, thank you so much.
Nisha, do you have a question? Go ahead and unmute yourself.
Not the question, but I would like to help people who has asked the question if they have Kaiser and they can have the acupuncture sessions approved. I do have Kaiser, I have Medicare, I have the Advantage plan, and they recommend the acupuncture therapies. And I have greatly benefited with those the therapies, and it's just excellent. So the knowledge you have provided, it helps me how this works. It's just greatly appreciate that, and would like to answer the question somebody asked, that if they have Kaiser and they can get that. You can call your physician and tell them to if you have the name of the provider, you can tell them that this is the provider I want to go to, and she will give you the referral, and you can get that approved. So yeah, thank you.
Thank you.
Thank
Who,
you.
who was talking that? I didn't catch it.
Say it again.
Now, who was talking about that? I didn't catch the name.
This is me, Nisha.
Oh, Nisha. Okay, got it. Yeah.
Anyway.
Okay. Now I understand. Sorry about that.
And just to clarify for everyone, if you have Kaiser, that's the process to go through. But also a lot of plans, PPO plans, for example, you have deductibles to meet essentially. So my sessions are priced a little bit more than a copay, so you would have to meet your deductible anyway. So just some information about how it works, and you don't need your physician's approval to book an appointment or schedule an appointment with my office. So just in case anybody's interested, please feel free to reach out. Again, I'll share my information on the screen. Feel free to take a photo and share it with your family and friends who may benefit from it. But I've definitely seen a lot of people who have just improved their quality of life with natural ways, not taking any medication that has so many side effects. And it's just a natural alternative, holistic care for health. Yes.
Sometimes to attract new patients, they have a free consultation. Do you have that?
Sure, I can, spend a couple of minutes on the phone with you, but the extensive and comprehensive consultation and evaluation does happen through our first session before your first acupuncture appointment. But yes, I'm happy to get on the phone and just answer questions and see how I can best help. Definitely.
Good to know that. Thanks.
Of course.
Thank you so much. Any other questions? Okay, so I do have one for you. Um, are these kind of like sessions, is it like, does it have to be continuous sessions, or is it just based off of like, oh, if you have an issue, health condition, it's one appointment, and that one appointment you'll get your full treatment, or is it kind of just come back?
Yes. So acupuncture works in a series of treatments, and it's a course of treatment, just like you take a course of antibiotics, for example. You must finish the course in order to see the best benefits. So a typical course of treatment in acupuncture is between 8 to 12 sessions. And usually you're coming in twice a week for the first week, and then you scale back to once a week. Or if you've had, let's say, chronic pain for about 10 years, that pain is going to take a little bit longer to move it, to get moving, for example. So I've had a patient who's come in for back pain. She's had it for about 15 years, and it's very, very difficult for her to bend forward. This is within the last 2 weeks. So she's come in twice a week. After that first session, her back was already feeling better. After that second session, the same week, definitely better. But the pain does come back. So that's why I'm having her come in twice a week for the first 2 weeks. And then we scale back to once a week until, symptoms improve. Everybody responds differently, how long your pain's been there, what exacerbates it, your lifestyle, things like that. But a course of treatment typically is between 8 to 12 sessions, coursed over, 2 months. And it's important not to let too much time pass between each session. That's why, that you come in more frequently in the beginning, because we lose the progress that you make during the first session. So just like anything, you can't go to the gym once and expect yourself to be fit. But also, the reason why there's a course of treatment is because we are rewiring neural pathways. We are reducing inflammation. We are signaling the brain to create those internal opioids, those painkillers, to reduce inflammation, to balance those hormones, to create the internal hormones. So there's a lot of work being done, and that's why it's always a course of treatment. And I always advise patients that if you're not able to commit to something like that, then I'm going to just be very upfront and very clear that it's not a one-time thing. It requires a course of treatment, but because we are treating the root cause of the issue and not just giving you medication to mask the symptoms, that's why it's a investment in your health and time.
Thank you so much.
Of course.
And then I do have another question as well. I believe you mentioned cupping in the beginning of the lecture. What's the
Yes.
difference between cupping and the difference between acupuncture? Is it completely different? Are there similarities? The technique is different? What is that?
Yes. So traditional Chinese medicine involves acupuncture, cupping, Chinese herbal medicine, nutritional counseling and guidance, dietary therapy, and also different modalities like stretching and exercises. So cupping is essentially it's called dry cupping, and we basically use suction cups on the surface of the skin to draw up your blood to the surface. And what that does is, I'm sure many of you have seen some of the bruising and the round. What that does is it brings up blood to the surface and it diffuses the lactic acid in the tissue. So when the tissue is compressed with lactic acid and not a lot of blood flow, that's when pain happens. It's stiff, it's tight, you feel very painful. So what the cupping does is it brings blood to the surface of the skin and it allows for fresh oxygen to reach the tissue and the muscles, and it decompresses the tissue so that it's healthy again. You're able to move around and have less pain and stiffness. So I do use cupping in my practice as well as in addition to acupuncture, in addition to myofascial release, which is the fascia, which is like a network. It's like a spider web all over the body that, helps all the organs sort of stick together. And it's very, very effective.
Perfect. Thank you so much. And I'm sorry I'm asking you all the questions, but it's
No,
a
thank
very
you.
interesting
Yeah.
concept to me.
Of course, it is. It's
Um,
a fascinating medicine. It's been
yeah.
around for thousands of years, and it's evidence-based, and it's helped so many people. And unfortunately, also with, the aging population and aging in general. As you age, you have more issues and more complexities, and
Mhm.
unfortunately, our modern medical system sometimes falls short in terms of longevity and preventative medicine. It's all about, symptom management and giving you medication for pain. And I'm not about, this or that and bashing. No, I'm an integrative practitioner, and I think it's very important to work with current providers. But when you're aging, you want to age gracefully and you want to live a healthy life, and we don't want to take a medication to counteract the side effects of this other medication. You want to live peacefully and balanced. You want to feel good. You want to be able to pick up your grandchildren. You want to be able to, take a walk with your grandkids, or just, with you and your wife, or whoever it may be, your family. So that's when, this medicine really steps in.
And just to build on that, because a lot of our, we have a lot of seniors. And so my question is there any different, like, is there a different type of method or treatment for seniors versus, people of younger age?
No, not necessarily. Every person that comes in, regardless of their age, is given an individualized treatment plan based on their specific diagnosis, and also their based on their constitution. So somebody who has back pain who is 65, and somebody who has back pain that's 72, their back pain might be differently caused by different things. We have different pathologies in the body. So that's why in the initial appointment, we do a very comprehensive evaluation and consultation. So where is the pain? How long has it been? What is the quality like? Is it better with heat or cold? Do you run hot or cold? How's your sleep? All of that gives me an idea as to what's happening in the body, to give a very proper diagnosis so that I can treat that person properly. And it's irrespective, of age, really, because everyone's pain or issues manifest differently. But definitely with the aging population, we use, more gentler methods, for example, but still very effective.
Perfect. Thank you. You guys don't let me hog the floor. You're more than welcome to, ask questions too.
Okay, I have a question. Now,
Absolutely.
after you put in the needles, do you attach it to give some vibration, to the machine or something like that?
No.
And then, no? So
No.
after you take out the needles, do you do massage with the pressure point? Do any kind of massage also?
So my service in like a traditional massage, no, but we use myofascial release on the points.
Yes. Yes.
Yeah.
On the point. So you press it and then carry the.
So instead of doing the acupressure, I actually use the needle to go into that specific point, which is more powerful than actually the massage.
Okay.
I've given you like the acupuncture points we did today are things that you can do at home at any time. But when you insert the needle, because that's activating all the mast cells, all the nerves, all the dendrites, and it's communicating with your brain, the needle activates something much more than just the pressing can do. And with those moving cupping and the dry cupping, we can really address sort of everything.
The movement, oxygen, right.
Definitely.
So you went to school here in Los Angeles, acupuncture?
Yes, I studied my master's in Los Angeles, and then my doctorate I did in San Diego.
MashaAllah.
Yes.
Okay, because there's a doctor I know, Dr. She used to teach there, and she has a clinic here now.
Wonderful. Okay. Yeah, I've never met Dr. She, but I'd be happy to. I'd love to meet her and to connect people of the same profession. I think it's very, very important.
Yes.
Yeah.
Our Olivers have great connections.
He said he was teaching there for 25 years. I said,
Which school? I know there's several schools in.
Oh, okay.
So
It
there's
depends on where she went. So now she, after retirement, she opened her own this thing.
Oh, wonderful. Okay.
Is this a common procedure besides in China?
Yes, acupuncture is actually so every major hospital now, from Johns Hopkins to UCLA to USC, has an acupuncture department in their hospital. Because it's so useful for oncology, for pain. So cancer is a huge area as well that, acupuncture has really been very helpful in reducing those side effects, the nausea. I have a lot of oncology patients as well, but acupuncture has been gaining so much traction, especially within the last 10 years in the US, because of the lack of side effects, because of people's, improvement in their pain and in their quality of life. So it is now actually in every major hospital in the US, at least in California, and also places and hospitals like Johns Hopkins, like huge, facilities and research facilities that are, really spearheading acupuncture and acupuncture research.
Interesting. I didn't know
And the
that.
fact that it's, covered by Medicare, acupuncture has been covered by Medicare maybe for the last 5 years, and that was a huge groundbreaking deal, is because it is very effective for managing pain. And so the federal government would not back acupuncture if it wasn't effective. It's actually backed by the federal government and the National Institutes of Health, and and CBI, the huge database of research, is filled with acupuncture research. So it's amazing, amazing medicine, truly. And I hope
Inter-
that, each and every one of you can really experience, and I know some of you here have experienced just the transformative effects of it.
Interesting. Yeah, I didn't know that.
And if you have any questions, really, you have my number. Feel free to call me, to message me. I'm always happy to answer questions. I think education is a big, huge part of not just, me for my business. It's for actually spreading awareness. If people are dealing with pain, debilitating pain, that, their knees are hurting so bad they can't walk, and they know that something is out there that could help them, let's say get up and go for a walk, and they can go outside and see the sun, that whether they come to me or somebody else, I think it's important to get that information out there, because there's help, there's hope. Yes.
Another question. Does
Yeah.
this help the people with the Parkinson disease?
I've had, yes, some patients with Parkinson's. We use Chinese herbs as well as acupuncture, and as well as dietary therapy for that. Yeah, and each level of Parkinson's is it's stages, right? Phases, depending on how far along it's progressed and things like that. But I've had experience with that as well.
I see. Interesting to know. Good.
Yeah.
And for these like dietary needs or like like Chinese herbal medicines, are these supposed to be continued like during the duration of the treatment, or like how does that work?
Yeah, the Chinese herbal medicine. I have here a Chinese. I'll turn the. I have a Chinese herbal pharmacy. It's a small
Oh,
pharmacy that we have all of the Chinese herbs on there. But if there's a formula that I think is more appropriate, I'll always order it custom for the patient as well. But yeah, the Chinese herbs are taken in conjunction with the treatment to help improve treatment outcomes. And then the Chinese dietary therapy, it's not just eating Chinese food, but it's looking at food through the lens of Chinese medicine, meaning that there are certain foods, for example, that are very cold in nature, and that they have a cold thermal quality. And so people that have, for example, cold symptoms in their body should not be eating. And they can be very common foods that could be exacerbating their symptoms. So I work with each individual to sort of customize and give them ideas about the foods they could be eating, or they are eating, that could be harming their treatment progress and their bodies, and just suggest other alternatives as well, and give a very detailed nutritional plan and guidance, and along with supplementation and Chinese herbs.
and then in between sessions, in addition to like, the Chinese herbs and supplements, is there anything else that's like part of the care plan?
Yes, so each person has a different care plan and recommendation.
Mm.
So I always tell patients, acupuncture and Chinese medicine is opening up the doorway. It's getting you halfway there. And it's really up to you as well to continue the other half, because there's nothing that you can do that's miraculous, that's going to heal everything, right? But, some people can be coming in. I've had several people, they come in and they feel so much better. Their back is so much better. But then they're going and working in overdrive, right? So now they have back pain again. So their back pain is gone, but you also have to allow your body to heal. So you could be coming in for treatment, you're getting better, but you're also doing things that are putting your body in the same position in the first place. So I work, with people to modify how they're bending down, for example, right? You can't be bending down from the hip down. You got to bend down in a way that's ergonomic, that's good for your spine, so that the pain doesn't come back. So each person has a different care plan for home. Always, I recommend stretching, exercising, keeping your body mobile, mobility, good sleep. So I work with patients to really look at holistically their whole life, the things they could be doing in their day to day that could be improving their treatment outcomes, or not. So
Thank you.
thank you
And
for
that's really Oh, sorry, go ahead.
By the way. No, I really appreciate the questions. I think it's very helpful, and I never want to feel like I'm just lecturing people. So I think questions are very helpful. Yeah.
I'm glad. And I do just want to say that, it's a very common saying where when you go to a doctor or when you go to an acupuncturist, that's only half of it, right? So that's only half the treatment. The other half of the treatment has to come from you and like your efforts and what you're trying to do for your health.
Absolutely.
Where is your office located? A
I
medical.
am located in Irvine. I'm off the 5 and Jeffrey.
Oh, got it. Mhm.
Also, just to build on that, so a lot of our seniors, they don't have transportation or just, they're often homebound. So is there any type of service that would allow you to do home visits or, something like that?
At the moment, it's I do have a busy, clinic in Irvine, but if there are, people who are interested in home care, they can take my phone number and I can work with them to see if that is something that's appropriate and suitable for them, and also, depending on where they are. Obviously, I would be taking time away from my clinic, so that does also factor into just the cost per session and things like that. But something that's I've done actually in the past. I travel care for seniors as well. Yeah.
Yeah. And then I also heard that acupuncture helps with both physical and mental
Yes.
well-being as well.
Yeah. 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 Physical, mental, spiritual health.
Mm.
It's, when your body and mind are in a calm state, because, you know, our bodies are governed by our brains, right? And so acupuncture works on the brainstem, actually works on your nervous system, which is controlled by your brain. So that mental and physical well-being is very much mental and physical in Chinese medicine. They go hand in hand. When your body is regulated and healed and calm, and there's no inflammation, the mind follows, and vice versa. So
Mm. Got it, got it. Any other questions? I can keep going. This session is for you guys.
Yes, I have a
No?
question. I would like to know how acupuncture helps neuropathy.
very good question. So when the needle is actually inserted, they've done studies. Well, let's say I have a patient has neuropathy in their hands. When the needle is actually inserted into this point, it promotes local nerve growth. So it helps your nerves grow in that area, but also because it is promoting blood circulation. Blood brings with it the necessary nutrients that the tissue needs to heal. So, because acupuncture is essentially stimulating that specific point, and that specific point works with your brainstem, and your brainstem and your brain is the one, and your spinal cord, your brain and your spinal cord, that's the one where the nerves originate from. So it's this, communication pathway. This point is telling your brain, hey, we need some local nerve growth here. Please, send blood circulation, oxygen to the tissue so that we can heal. It's giving them the building blocks it needs to rebuild and repair, locally, but also systemically.
Interesting.
Thank you.
Of course.
And another question, do you feel like acupuncture interferes with, other types of treatments, whether it be like medication, things like blood thinners, in case you're just, using acupuncture? Does it do any of that?
No, acupuncture is and it's incredibly safe in conjunction with other therapies like chiropractic, physical therapy, in terms of medications and blood thinners. So when a patient comes in for the first time, we're always asking what their current medication regimen. So if they're taking blood thinners, antihypertensives, antiplatelets, and I want to prescribe them Chinese herbs, I'm always making sure that the herbs that I'm prescribing are safe to take with their current regimen. Of course, in order to be licensed, we're very versed in pharmaceuticals and also the safe prescription of Chinese herbal medicine. Generally, they are very safe, but there are things that we avoid prescribing with patients who are taking blood thinners or things like that. That being said, yeah, if somebody's just coming in for acupuncture, it's incredibly safe. Even Chinese herbs, incredibly, incredibly safe. So very little side effects. Actually, it will complement some of the care that they're receiving if they're doing, different physical therapies and treatment.
And in addition to just better physical and mental health, can you go into like more specifics as to like what what's beneficial about acupuncture, whether it helps with like sleep, just memory, things like that?
Sure. So, the reason why acupuncture works on improving sleep is our bodies, when we wake up, we it's guided by the nervous system, right? There's one big umbrella nervous system. There's the parasympathetic and there's sympathetic. When we are in our day to day, we're in the sympathetic nervous system and we're stressed out when we're going, right? But that part of our nervous system is consistently activated, and we're living a life that's consistently running on only one mode. So it's one half of the equation. When it comes time to sleep, your system needs to just go to the next, right? Which is the parasympathetic. It's your rest and digest. It's that mode in your body when you feel like let's say if any of you have gotten a massage, like, oh, I feel so nice, I feel relaxed, I feel calm. That's your parasympathetic nervous system. So what happens when I insert the needles, it activates that part of your nervous system, the parasympathetic. That's why when you are going to sleep at night, that system needs to be the one that's activated. So acupuncture helps regulate that system, helps you remain calm. One of the first things that I hear when I take out the needles is, I feel so much better than when I came in. And it's a lot of people actually fall asleep on the treatment table and they always ask me, did I snore? But it's this incredibly restorative and deep sleep because your body is so calm and it's so regulated. Inflammation is reduced. They've done MRI studies on people who have actually have received in real time acupuncture, and they see the blood vessels dilate, they open up so the circulation can be open. They're seeing all these things in real time if they've done incredible research. But so that's how it can help you sort of sleep. It calms you down because when we're stressed and we're, in our day to day and we're in pain and inflammation, that part of our nervous system is just heightened. So it helps you calm your body. In terms of mental clarity and focus and energy, because it is improving all your organ systems, in your digestion, when you're able to extract the nutrients you need from your food that you're eating, you're able to create those building blocks that you're able to create that energy, that ATP, the cellular energy that it needs. Acupuncture works on that. It works on all these micro circulatory pathways in the body. And I'm just explaining it in big terms, but it has these incredible scientific under the basis of how it works. It helps you. You have this energy, this stamina. You're sleeping better. You have less pain. You have less brain fog because it's improving your circulation. It's improving your quality of life. Your stress is reduced. When inflammation and stress is reduced, a lot of things are your body's given an even sort of keel to heal. So it addresses so many things at once, and it naturally it gives so many good benefits.
I think that's also why it's very popular in Western medicine as well, where when you combine Western medicine with Chinese medicine, it goes hand in hand, right? So combining the two gives you a better outcome, just a better overall period of recovery, and just, yeah, like Dr. Noora was mentioning, just better overall quality of life.
Absolutely.
Thank you so much. Any other questions?
Very good
No?
session. Very educational.
Oh, thank you. I hope you found it useful and beneficial. Thank you so much for having me on today, Zoya.
Olive Community Services is a 501c3 nonprofit organization based in Southern California that provides culturally appropriate services to seniors, their family, and the community. Through its physical and virtual interactive programs, Olive engages participants in a variety of ways that promotes health and well-being. To learn more about Olive Community Services, to get involved, or to make a donation, please visit www.olivecs.org or email info@olivecs.org. Be a change maker, and together, let's live, learn, and thrive.